Hi, I'm Deepika Narasimha. I'm one of the first-year cardiology fellows at Loma Linda University, and I have here the pleasure of talking to Dr. Reynolds, who is the co-director of cardiovascular research at NYU School of Medicine. So how are you, Dr. Reynolds?
I'm great, thanks.
All right. So what do you think so far of the ACC 2016 session in general, and particularly the Women in Cardiology sections? We've had quite a few sessions, so what do you think of them?
I think this has been a great one. I particularly liked the Women in Cardiology intensive, and I thought that there were so many different cool things that we did. So we had these case discussions, and for once they were really active discussions because people got up and talked and were submitting questions, and I think that made all the difference. And I thought the poster breakout was great, and I would love to go and do more field trips to go see posters and then talk about them. But I think we have to prepare our poster presenters for it because the poor things, I think, were like deer in the headlights a little bit.
Right. As you said, you're the co-director of research, and we don't see a lot of women in academics or academic medicine. So, could you tell us a little bit about the opportunities that there are for women, particularly in academics or, in just pursuing research?
Well, I've been very lucky that I work in a place where the director of cardiology is a strong supporter of female cardiologists and of letting people do what they want to do. So I'm one of those people that always wanted to do everything. I always wanted to see patients. Seeing patients is extremely important to me. I love doing research and I love education. And I've been lucky that I have a director who lets me do all of those things. But I think that doing all three things, although a challenge in terms of time, and there are moments when I have a grant deadline where I really curse myself for doing all these things and say, Harmony, remember, you're living the dream. This is what you wanted, even though it's a little too much for me. But still, having all those things at some point makes it easier for me to manage work-life balance because the practice, when a patient is sick, that person is sick and they need my full attention and there's nothing else to be done about it. But because I have the research side, I have fewer of those things that wake me up at night and take me away from my family. And research most of the time will allow me to put something off until tomorrow so I can go to my kid's baseball game. And then I can always catch up because I'm willing to work hard. So for me, having the balance has actually made it easier for me to balance my life.
Oh, great. 'Cause my next question was on work-life balance, but then that was great. Thank you. And then, in general, what advice do you have for young women in cardiology, especially fellows and residents, looking to get into cardiology?
I think that you have to know what you want, ask for what you want, and go after it. And, we are all willing to work hard for the things that we're passionate about, and I think we need to make that clear.
Wonderful. Thank you so much. This was great. Thank you.